is Doc Sally's Jungle Medicine podcast. Aloha again. And we are here with our lovely patient who has volunteered to help us today. This is Grace. And we have done her physical exam, and we have determined that Grace needs to do the stomach acid test, or as I like to call it, the stomach acid challenge, because we suspect that she has low or insufficient digestive enzymes, stomach acid, and that is causing all kinds of distal problems and all kinds of far-reaching health consequences, which we can talk about another time. But today, we're just going to show you how to do this. Okay, the first thing we're going to do is examine Grace. So, can we examine you real quick and show people why we need to do this?
Yeah.
Okay, so lay down real quick.
Okay.
So, what we're going to do is we're going to very simply, I'm going to poke a spot on your tummy, Grace, and I'm going to poke it this hard.
Okay.
Does that hurt? No, this doesn't hurt. So, all you're going to do is compare that to this. But I have to find my spot. It's a very specific spot called the Chapman reflex. And it goes right along the rib border here, and then we find the sternal notch, and we go in here, and just slightly under, we're going to poke about the same intensity. Ready? Go. And Grace laughs when she's in pain, which is something interesting to note. That hurt, right? That hurt more than this.
Yeah, for
okay.
sure.
So on a scale of 1 to 10, honestly, how uncomfortable was that? If 10 is please don't do it again.
Like a 7.
Like a 7. That's pretty sore.
Yeah.
That is a nerve that runs close up under the skin from the stomach. So the stomach doesn't have a lot of nerve endings. That's why you can have a bleeding ulcer and not know it. So we can have dysfunctional stomach and not be very consciously aware of it. So we're trying to make that conscious, okay? So now we're gonna do our stomach acid challenge. I'm gonna send Grace home with a long handout that explains exactly how to do this. But people don't read much anymore, so we're gonna tell you how to do it. All right, let's explain what's going on. All right, if this is Grace's esophagus, okay, and then this is Grace's stomach, and then this is going down into Grace's intestines, which we're gonna just stop there. Most healthy people make 3,000 to 5,000 milligrams of stomach acid per meal, okay? My little pills, my Zypan that I use for this test has 100 milligrams per pill. So you can see it's very mild, very gentle. It also has nutrients in that help heal the stomach. So we're healing as we're testing. We're treating and testing at the same time at home for free. Yay.
Yay.
Okay. There is really no lab test anymore that I know of that can check this directly. This is because it's a functional situation. If you put a scope down in here, you can look at the stomach wall, but you can't tell how much acid it's putting out when you eat. Okay, so that's why we have to do this way. So anyway, a healthy stomach makes this much acid, and I'm just going to symbolize that right here. A healthy stomach would make, let's say, that much acid, and we would eat, let's say, green is food. Okay, let's say Grace eats this much food, and the acid mixes with the food. This mixture here should be pH 5, okay, pretty acidic. Water's pH 7, okay. So when pH 5 goes down here, it's very important that this food mixture be this pH, because that triggers the pancreas and the liver to release their enzymes. So this is a key to making sure the whole digestive system works well. So it's not just about, is my stomach acidic enough? It's about, can I digest my food properly? Okay? If you cannot digest your food properly, the protein in the stomach properly, you're going to crave carbs like crazy. And if your liver's not releasing bile, you won't be able to digest fat. So you'll start getting weird aversions to food, and you want more and more sugar. So this is huge. Okay, fundamentally huge. Okay, so let's say if this is 3,000, and Grace should be making that, but oh no, she's not, because she had a huge stress last year. She was hit by a car or something. Her stress level diverted energy away from her gut wall to her heart and muscles to run from something scary. So now poor Grace is only making that much. Okay, and so see how much of her food she's digesting well? That much. Big problem. Our job is to figure out what this difference is. Like in the Price is Right, what's the difference without going over? Okay? So, which we don't know, because that's different for every person. Here is a detail that's important. You have a little mucus layer that protects your stomach wall, that coats your stomach of slippery slime stuff like a little snail trail. You have that goes all the way through here, okay? It stops right here, the bottom of the esophagus. So we are going to very slowly and very gradually add a little bit of enzyme. And if we take in too much, it's going to float up too far and it's going to irritate right here. It's going to get a little bit of true warmth or true heartburn. Okay? That's when we know we have gone over for this person. It's when it floats up. Okay? So, it's a really simple thing then. We take our product called Zypan. On our first day with our first meal, which a meal is your cupped hands full of food that has to have a protein source in it. Don't do this with a salad. Don't do it with a smoothie. Has to have a protein source, a hunk of tofu, beans and rice, meat, protein, okay? We're gonna take a half of a pill with one meal. And why is that? If you are so deficient for so long that you're not really making any acid anymore, your food will sit and rot in here, and that's what a lot of people call heartburn, by the way. But if it keeps on going, your body stops making this coating, okay? And now you've got bare muscle holding a bag of food, okay? Bare muscle does not like acid, okay? So if your stomach wall is in serious distress, even before you get an ulcer, you'll get something called atrophic gastritis, and even a little bit of acid provided will hurt. These are people who tomatoes they don't like, or pizza they can't tolerate anymore, or vinegary dressings hurt them. They do not have this nice protective layer anymore. So if that's your problem, we stop right there. So if half of one of my tablets causes any irritation, you either have a frank ulcer or you have atrophic gastritis. We stop this protocol. We do a different plan to heal that. It's healable, okay? So let's say you passed that. You took half. What happened? Nothing. Okay. Now, that was test day. On day one, we take one tablet per full meal of food. We don't do it with snacks. The meal has to have protein. What should you notice? Nothing. Exactly. Most people can tolerate a slight variation. If we're supposed to make 3,000 to 5,000, 3,100 is not that big a difference. You should notice nothing. Okay? On day two, what do we take? 2 per meal.
Yeah.
2 per meal. What should you notice? Nothing. Most healthy, normal people have enough gastric acid fluctuation per meal that 2 tablets should not bother them. And this has been standardized over thousands of tests and dozens of years. So we pretty much know this, okay? On day 3, what do we do? 3 per meal. Okay. So now we're actually starting to add a little bit of acid here. A healthy, normal person that's making full capacity is going to start noticing a little acidic feeling, a little irritation, mild irritation from 3. Okay? At which point they go, hey, I'm normal. They stop the test. Okay? So you should be able to tolerate 2. At 3, we might show a little bit of irritation. On day 4, what do we do?
4 tablets?
4 per meal. Okay. So a normal person that's making their correct amount of acid, if we start adding 400 milligrams, they're going to start feeling a little uncomfortable. Okay? A person that has gastric acid deficiency, though, if we're down here, this is Grace. Let's say she's here. Okay? And we've added a little bit. All she's going to do is digest her food a tiny bit better. She's not going to notice much.
Yeah.
So we keep going.
Okay.
So on day 5, we take how much?
5.
On day 6?
6.
On day 10?
10.
On day 15?
15.
On day 20?
20.
Okay. So
Wow.
we keep going up by 100 milligrams, which is a tiny amount, per day until we get to your level of where you are finally a little bit overdosed by just about 100 milligrams, okay? If you on day, let's say your magic day is day 24, 24 tablets
For each meal?
For each
of the
meal.
day,
Mhm.
with protein.
with protein. So let's say finally on day 24, you start getting a little bit of warmth in your tummy. That's the most common symptom. That means you needed 23 to be fully replaced. Okay, that means for the first time in your life, maybe, or in a long time, you're actually the correct pH here. That means your food your chyme mass, your food that goes down through the rest of your system is for once, finally, the correct pH. That means, bing, 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 all of a sudden great things start happening. Okay, so you were burning at 24, the next day you go down to 23. Now all of a sudden you're optimized. Okay, so your food is pH 5. Wow, that's so cool. Now when we go down here, our pancreas starts working better, our liver starts working better, our small intestine starts working better, we start moving through better, peristalsis gets better. Okay, so this supercharges the whole system. So that's why we're doing it. So back to this, we keep going up, and whenever you get to your particular spot where you're like, that feels like too much acid to me, you stop there, okay? If you feel really like that was unpleasant, you take a Tums, okay? Or you take a teaspoon of baking soda in some water. If it was caused by too much acid, actually really too much acid, baking soda neutralizes it instantly. It's a chemical reaction. It turns it into pH 7, which is like water, and it should stop. That can help you differentiate, is this really from too much acid on my test? Or did I eat too much at the local pizzeria? Or do I have food poisoning or something else? Okay, because acid will be neutralized quickly by Tums or baking soda. So simple way to tell. If you're not sure, you can go the next day and take another extra one. If you get the same warmth, discomfort, slight acidic feeling a little bit more, it was that. Okay, so some people do not get a warmth sensation at first. Some people get nausea, or just it feels irritated. Once in a while, people get loose stools from it if it's too much for them. So 75% of people, their cue that they are over is going to be warmth in the tummy. Occasionally, they'll get one of those other symptoms. Okay, so does that make sense? Do you have any questions?
I do have a question. So what if I already kind of experienced general like warmth in my tummy?
Mm-hmm.
Would it just be like an increased sensation of warmth in the tummy? Would it be...
You're looking for a new symptom caused by the acid.
Okay.
So the reason people are doing this test is because they have digestive problems.
Right.
So everyone coming into doing this test is going to have some kind of digestive problem from the beginning, and they're familiar with that problem.
Right.
This would be a new feeling.
Okay.
Okay, so, and you can tell because if you increase it, the new feeling gets worse. So what often happens while people are doing this test is their other digestive symptoms actually start to get better. Because as we raise our acid level, we're digesting our food better, and all the downstream symptoms get better. So you're going to actually kind of have this thing going like this.
Okay.
So part 2 of this, once you have found your number, let's say Grace's number was 24, okay, that means 23 is how much she needs. So 2,300 milligrams of acid is what she needs. We can then have her stay on that 2,300 milligrams of acid per full meal per day, and her body will suddenly start working better, and it will allow you to absorb the nutrients you need to make your own acid. So for the first time now you can, because you cannot get a lot of the nutrients you need to make acid if you don't have acid. This is one of my questions for a higher power. Why is this so? So it's hard to absorb zinc. You critically need zinc to make stomach acid. It's hard to absorb vitamin B12, especially if stomach acid is low. And you need those things to make this. Okay, so now we start absorbing them. So now all of a sudden we are digesting better. Okay, so we're at 23, we're churning along. A few days later, wow, 23 is too much. 23 gives me that weird symptom again. For you, maybe warmth. For someone else, it may be loose poops. Okay, great. Your body has learned to make its own a little bit with the nutrients and resources it now has available. Now we can make some. Awesome. What do we do?
22.
Good job. The next time, as soon as that happens, we drop to 22. Yeah. We stay at 22 until what happens?
Until you get the sensation.
Great.
Again.
Till you get your sensation of uncomfort. Okay? Then we drop down to 21, 20, 19. We wean off as the body says to wean off. Okay? Eventually, you get to where you don't need any at all. Okay? Or you can tolerate 2 like a normal person. Okay? And that means you have healed your gut wall, your stomach lining, and replaced this beautiful, important mucus layer, and you are producing the right amount of digestive enzymes.
Yay.
So if you do it my way, even though in the middle of it, it's a lot of pills, okay?
Yeah.
If you do it this way, you do not have to be stuffing down digestive enzymes with every meal for the rest of your life like so many people do. So in the long run, this saves you a lot of stress and effort.
Yeah.
Now, let's say you have done this and you have weaned off and you're churning through life and bam, you get hit by a car. What happens?
That trauma probably is going to affect it, and maybe you have to start over
Right.
again.
This problem is often caused by being in what's called sympathetic dominant mode, fight or flight mode, stress response mode, and eating anyway. When you're in stress response mode, you're trying to run from something scary. Your body does not want a sack of food in there swinging around while you're running from a bear. Okay, so we are designed to not eat during times of acute stress. But we have a hard time telling now between our frontal lobe issues, our chronic stress, our stressful thoughts, and actually a bear chasing us. So we tend to stay in low-grade chronic stress mode and try to eat anyway. And that is how a lot of these problems start.
Yeah.
So if you are healed by this and then you have a big trauma or a stress, or aging over time, there's lots of small stresses, so that can be a factor too. What you do is you redo this challenge. And if you nip it in the bud, as soon as you notice your stomach acid might have gone down, and it might be silent, but as soon as you think, hey, I had that car accident, I got a divorce, XYZ, I'm really stressed, I should try that thing. I have a lot of anti-aging patients or vitality enhancement patients that are well, but they schedule this every year on their birthday just to see if their stomach acid has dropped with age.
Yeah.
Okay? And that's my key cornerstone way to help keep healthy people healthy too.
Yeah.
So this is useful if you have gastrointestinal issues, but it's also useful as an anti-aging strategy.
Okay.
Okay, now, once in a while, once in 100 patients, someone will have a hidden ulcer that they don't know they have. And an ulcer is, this has gone on for so long, give me my eraser. They ain't making crap. They're not making stomach acid. In fact, they might have been on some proton pump inhibitor madness for a while. And that turns off what little acid they were making. Okay? And now they're not making this lovely slime layer. Their stomach is basically a steak sitting there, folded into a pocket with some rotting food sitting there. That's what's going on. Okay? That goes on for a while. The bacteria that come in on our food can actually stay in us. Our acid's not there to take it away. So then we get infections in this wall. And there's not a lot of nerve endings in the stomach wall. So you can have a pretty nasty infection in your stomach and not really feel much, okay? Vague discomfort. And then let's say we get an infected patch right here and it's an open wound in the stomach, okay? Very subtle. Unless you're going to test for that or look with a camera, you won't even know it's there necessarily. You just won't feel your best, okay? If that's going on and someone takes even a little bit of acid in, and it hits that thing, that would be like pouring salt right on an open wound. It's going to feel yucky, okay? If that happens, immediately we stop the test and we take some Tums or some baking soda, some kind of thing like that, aloe vera juice to coat, soothe and relieve, and we get ourselves back into our doctor, hopefully our naturopathic physician, to treat and heal this ulcer, okay? And we have to do that before we can go in and add our lovely enzymes. Okay, so part of that protocol is taking pancreatic enzymes to help you digest your food without an acid in the meantime, short term.
Yeah.
Okay, do you have any questions?
Just a clarifying question. When you take the enzymes with the food, are you taking the enzymes before or after the meal? Does it
Excellent
matter?
question. Excellent question. So the right response is take them when it works for you.
Okay.
Most people will start taking them during a meal.
Okay.
Okay. If you take them at the end of the meal all at once, you really need to make sure they go all the way down. These are little food-based tablets. They're small tablets, but there can be a lot of them. So during the meal is best. Okay. Aloe vera juice is great for helping them go down. And some people take them with something like applesauce to make sure they go all the way down. That's another option.
Okay.
Also, once people get up to a large amount of these, sometimes during their protocol they will switch to a different kind of product that has more HCl per tablet. For example, this product has 200 milligrams of acid per tablet. So if we're up to 12 of these puppies, that seems like a lot, we can do 6 of these.
Okay.
And keep going up that way, either with the Zypan or switching to the betaine HCl. So that cuts down on our pill amount quite a bit. Some people also find this to be onerous and too much. They will not do it. So I recommend to them that they either stay sick or at least try to do it for your 2 main meals of the day. Okay, if you can get in 2 meals of the day with protein in them and do this, it's still effective. So some people, it's just lunch at work, that's too hard, I'm not going to do it. It's like, okay, well, we can be moderate about this, but still make some steady progress. So you cannot get this brand on Amazon, but you can get this product through Fullscript, which is a quality control, tested, trusted resource for natural products. And the link for that company is below. The link's below. And if you follow these instructions carefully, it's a safe thing to try. You must do the test dose. Okay? This is a safe thing to try. And a book reference for this, by the way, we credit the lovely Dr. Jonathan Wright. He wrote a book called Why Stomach Acid is Good for You. And he wrote it decades ago. 20, 30 years ago. And it explains in detail why we need to do this test, why stomach acid is necessary, why proton pump inhibitors are given more than, the FDA only approved stomach acid inhibiting medications for human use for, I think it's about 3 months is what the recommended amount of time is. And I have people coming in here who've been on them for years and years and years.
Wow.
And they are now known to be associated with osteoporosis and all kinds of other nutritional degeneration, long-term chronic disease states, because you can't just wipe out our digestive system and not have problems with that.
Yeah.
So, by the way, if you are on a proton pump inhibitor medication, you cannot just do this test, right? Because your ability to make your own enzymes has been shut off by that drug. So you need to come in and do gut rehab, gut repair, wean off that medication first before we do this test. So that is the stomach acid challenge. Leave comments below. We'll try to answer your questions. Thanks for listening.